We cannot continue to remain in phase 1 indefinitely. To help our community slow this infection and support our efforts to get to the next phase, I am taking the responsibility as your health officer to place a masking directive. We have determined through a community survey done in partnership with Virginia Mason Memorial that only 35% of us are masking when out in public, and that number needs to be closer to 80% of us masking for meaningful reduction of infection transmission. This masking directive instructs each of you to fulfill your responsibility under Washington state law and your responsibility as a member of this community to follow infection control measures, in this case, masking in public. It specifically requires anyone in public settings, indoor or outdoor, to wear a face covering over their nose and mouth when around other people outside of their household if they cannot maintain at least 6 feet of distancing. The exceptions to this directive are children under 2 or children under 12 if there's no one to supervise face covering use, anyone with a physical disability making it difficult to wear or remove the face covering, those who are deaf or communicating with the deaf individual, and observation of mouth movement is essential, anyone advised by their personal medical care provider that wearing a face covering is hazardous to their health because of underlying severe health conditions, or anyone who has trouble breathing, is unconscious, incapacitated, or otherwise unable to remove the face covering without help. This directive differs from an order in that it does not include punishment for those who don't wear masks. While it is imperative that as many of us as possible wear face coverings in public with the goal of at least 80%, we do not want to place criminal charges or fines on people who may not be able to buy or make a face covering. For those who might say that this is a violation of your rights, I would say that I understand your anger and frustration. This pandemic has had an extreme impact on the health and economies across the globe and has impacted us all in one way or another, and it will have consequences for decades to come. You may not yet know someone who has been hospitalized or died from this, but you certainly have seen your favorite businesses, restaurants, places of worship impacted, or your children's schools closed. But here's the deal. We are all restricted and suffering tremendous consequences from the realities of the stay-at-home order and moving forward from the Safe Start plan. And we cannot move forward to phase 2 together until our county is in a safe place to do so. So, do we continue with the restrictions of needing to stay at home and keeping many of our businesses closed, or do we make a collective commitment to wear our masks in public, even if it feels restrictive, to follow social distancing and other recommended safety measures, and take collective charge of this situation? If you can wear a face covering and choose not to, you are choosing to keep our county in phase 1 longer. Your health department and healthcare providers can't stop this pandemic without your help, and no amount of anger or denial about the seriousness of the situation will make it go away. The last 2.5 months have been hard for everyone. So many have lost jobs, seen their businesses close, had to become homeschool teachers. Many of us haven't seen friends and family in person for months. Some haven't seen their new grandchildren or been able to celebrate weddings or grieve together at funerals. But worse, so many others have been seriously ill or died from this virus. So let's do this together. Let's commit to tackling this problem as a community. We all need to wear our masks to keep each other safe. As a sign of respect and concern for each other, the employees of the places we shop, bank, and do business, and for those we may interact with who have high risk for severe infection, such as those over 65 or with chronic medical conditions. And we need to wear our masks as a sign of respect and concern for your county in this time of great need. Many of you listening to this message are already infected with COVID-19 and either don't have symptoms yet or may never have symptoms, but nonetheless can infect others. If you wear your masks when around others and follow social distancing rules, that infection stops with you. Over the next several days and weeks, the Yakima Health District and our Emergency Operations Center will be coordinating the distribution of hundreds of thousands of masks across the county to those who need them. We believe that if we require you to mask in public, we should help provide those masks if you don't yet have them. If you cannot wear a mask for medical reasons or for the few other exceptions outlined in the directive, you will not be expected to, but all other community members need to do their part. The Washington State Department of Health has provided our county with masks to distribute for public use, but these masks are from surplus supplies of surgical masks and other medical masks. They are disposable and not for long-term use, so we encourage everyone to purchase or make a cloth face covering that can be washed and used long-term. This can be a mask, bandana, scarf, or other cloth face covering. The CDC website has several patterns for making your own mask, including some that do not require sewing. I also want to remind everyone that to be effective, masks need to cover the nose and mouth, and it is important to clean your hands before and after touching your mask, either with hand washing for at least 20 seconds or by using hand sanitizer. Masks need to be worn anytime you are within 6 feet of someone who does not live with you, indoors or outdoors. We will be repeating the community survey of public masking in several weeks to determine if we are masking enough as a community and to determine if further steps are necessary to ensure our collective safety. Additionally, I must remind everyone that for phase 1 of the Safe Start plan, there is still a requirement that you not gather with people outside of your household except for essential work. That means not having parties, barbecues, or other family or social gatherings that include people outside of your immediate household. Weddings, birthday parties, and even funerals for those who have died from COVID-19 will need to be observed in different ways. We must also avoid unnecessary public interactions, which means that instead of whole families shopping together, only one member of the family should go to the store. A recent study of the effectiveness of the Stay Home, Stay Healthy order done by the Institute for Disease Modeling shows a clear correlation between how much we stay at home in Yakima County and how well we contain the spread of infection. In addition to continuing to avoid unnecessary trips away from home, we must also continue to keep our hands clean as much as possible, to stay home with any symptoms of respiratory illness, to cover coughs and sneezes, and to observe isolation and quarantine recommendations. We will soon be in a position to offer isolation and quarantine facilities to those who cannot do so at home safely. When all this began for our county in March, local data predicted that without control measures such as the stay-at-home order, by now our county may have seen upwards of 100,000 cases and 500 deaths. I would be remiss if I didn't pause to express gratitude to those who have committed to following public health recommendations and to acknowledge all of those who have endured tremendous hardship. I also want to recognize all of those working in our long-term care facilities, our clinics, and our hospitals, risking their own safety to care for our county's most vulnerable residents. To our essential workers, we thank you for helping keep our struggling economy going. We will continue to partner with employers across the county to keep you as safe as possible when you need to be away from home. If anyone has concerns about their safety in the workplace, the governor's website has a link for reporting these concerns, and the Yakima Health District has a technical assistance team ready to provide on-site support to employers and to help arrange testing for employees as needed. To that end, we currently have adequate testing abilities in the county, and we urge anyone with COVID-19 symptoms to get tested as soon as possible with the goal of having a test within 2 days of onset of symptoms. These symptoms include cough, shortness of breath, fever, sore throat, chills, and loss of taste or smell. If you do not have a primary care provider to help arrange for testing, the National Guard is operating 2 mobile testing sites at various locations across the county for at least the next 2 weeks. The testing schedule can be found on the Yakima Health District website. We cannot continue to remain in phase 1 indefinitely. So let's do this together. Let's commit to tackling this problem as a community, with each of us doing our part in masking in public, so we can move to the next phase safely as soon as possible.